Hey guys, Dr. Anderson here. I'm here with Joy, and I think we might be talking to her husband a little bit, Mike.
Hmm.
And they're down in Florida. I'm here in Colorado. She came to me quite a while ago with a drop foot issue related to hip surgery. That's kind of the topic. And so I'm probably just going to let you tell your story because I've learned the better videos are the ones where I kind of shut up and you just tell your story. And we
Oh,
start with that, and then I'll maybe
okay.
interject with some questions. And I guess the lesson to be learned from this is never give up if you got a drop foot. Uh,
That's right.
we almost gave up hope with you, and she has had dramatic improvement
Hmm.
way out longer than you'd normally expect, or at least I would
Yes.
expect from my experience. So, but I'll let you
Yes.
take over.
Okay.
Start from the beginning, like
Hmm.
because
Okay.
you're a fairly athletic lady and you had to have
Hmm.
surgery, and
Yes.
yeah, just take it
Yes.
from there.
Okay. Hi, my name is Joy Leader. I was very athletic. Still trying to get into being back to my normal self. But yes, I would run marathons, Ironmans, and which of course led into hip problems. So I did have to have a hip replacement, which I did June of 2023, which resulted in drop foot right
Right.
away. I had a lot of pain. Of course, I did not have dorsiflexion at all. I could not walk. My lower leg was throbbing with pain. So I did have the nerve conduction study test done, and it showed compression of the nerves.
Right.
So, from there, I did not know what to do. My doctors here did not know what to do. So I was really on my own. So knowing about decompression surgery, I had to research on my
Right.
own. And that's when, I was researching and I found you, Dr. Anderson, and
Right.
knowing what you have done with your patients in the past with drop foot.
Right.
So that's, where I led me up to you.
Right.
And then, of course, flying out to Colorado and having the decompression surgery.
She had surgery, folks, about 4 months roughly after this all happened.
Yes,
Right.
yes, it
And one
was
thing I
right.
suggest to patients listening, I mean, one of the little pearls, if you're in the peripheral nerve space like I am, if you have a drop foot from a surgery per se, let's say it's a hip replacement, and you're not dramatically or you're not progressing towards improvement in the first 90 days, that's how aggressive we might be. We would recommend, hey, if you're not progressing, don't wait a year. Within 90 days is usually when we might say, hey, you know what? If you've not gotten any better at all in those first 90 days from a drop foot incident from a surgery, you might want to be stepping ahead with surgery. And so you came to me at 4 months.
Yes,
So you're
yes,
kind of in the gray zone. You're like, okay, it could
yeah,
be better
yeah.
if you came in early, but it wasn't that
Hmm.
late. Okay.
Right. And especially
Okay.
with the neuropathy as well, because I remember you were
Right.
mentioning that too. So right
Right.
after the surgery, I still had the drop foot, but over time, my neuropathy kept going away, kept going
Right.
away. And I
Right.
had the AFO brace that I still would use. And I know we were kept in contact about it and said, well, maybe it'll come
Right.
back. But it was knowing that it was, the hip region, but decompression and the nerves in the lower leg.
Right.
So there was always like hope. I always had
Right.
hope. And
Right.
knowing talking to you, you gave me hope to keep going
Right.
and to keep going. And so I did. And after a while, I was just thinking, well, maybe it's just the AFO brace I would wear.
Right.
But then after a while, it was 11 months after my hip replacement that I start feeling movement in my foot.
Right.
And then I felt a little bit of my dorsiflexion. It was so minor. It was so
Right.
little. I couldn't even believe it. I could
Right.
not believe it. I had asked my husband, is this moving? And yes,
So
I
this
did
is,
have a little bit of dorsiflexion.
if I can count back, that'd be like 11 months after surgery on your hip, but about, what would that be? 9 months, maybe, or 8 or 9 months after my surgery. True?
Yes.
Because
Yes.
what I did, folks, for those of you listening, I did surgery on a nerve called the common peroneal nerve, which is right below your knee joint. And that's the main nerve that affects all the muscles that pull your foot up. and moves your foot sideways, which if the perineal nerve is entrapped and there's compression, that can lead to drop foot. So that's what I opened up. And I'd open up another nerve down lower in the leg called the superficial perineal nerve, which also helps. So bottom line, in summary, you are having a lot of improvement of your nerve symptoms, like the burning, the tingling, the numbness, but you weren't seeing much what we call motor improvement. Strength was not there until way late. So
way late, right? And I never gave up. And just thinking about you and what you helped me so much. I mean, more than words could say. I just was so thankful. And then when my dorsiflexion started coming back more and more, and I just couldn't believe it, but I went to physical therapy. That was really important. And now I'm to the point where I can walk without my AFO brace. I have dorsiflexion where I can walk with normal shoes, with sandals with a strap. I'm back to work. Well, I always was at work, but I don't have to wear my AFO. My physical therapists say you need to stop wearing your AFO because you have enough strength.
Awesome. Okay.
So that's where I'm at. And I'm really excited about it.
What do you think, 70, 80% of your strength back, or rough estimate?
Rough estimate about 75%.
Okay,
yeah, about
good.
75, up to 80. Yes.
Okay.
Yep. And my dorsiflexion, it can only get better and better and stronger, because I still have a little bit of tingling, but it's not as much. But over time, I hear that's going to go away.
Okay. So I'm just trying to let people know she's a little bit of an outlier because after about 6 months of not getting better, it's like, my hands are kind of thrown up. And I talked to you yesterday. It's like I got so excited. I said, we got to get on. We got to share this with people because, I do drop foot surgery a fair amount, but we don't always see people out this far. So that are this improved. So, I mean, the drop foot's got to be a dreaded problem because you're so active. I can't imagine how that must impact you trying to be physical again. And hopefully you can get back to maybe even running. Who knows?
Right. That's what my physical therapists say. Well, we're going to try to get you back, but it takes, it's a mindset. It really is. You just keep on going and keep on going.
Right.
And, we didn't know. I remember we talked over the months after, and just keep on going, being positive about it. And just, trying your best, to keep that strength, even though, you just, there's times you just don't want to do it, but you got to pick yourself up and keep on going. So and I still have my dorsiflexion. I have it. So,
so anything you wanted to, anything else that you'd like to share with people listening that have drop foot, or because you've had it, what's?
I've had it.
Like, how did you find out about me? That's because so many people they assume it's from their back, and they are told, "Oh, wait a year." What drove you? What compelled you to come to see me that quickly? Because a lot of people aren't in that frame of mind. They don't do that.
Right. They don't. It's just because of my mindset that I knew I will get better. I will. I push myself because, being an athlete, you push yourself anyway. Right. But just knowing that there is someone out there, I know there's someone that can help me.
Got to be somebody. Okay.
There's got to be somebody. And then when there's no one here, and I'm not putting where I live down at all, there's good doctors, but no doctors perform what you do and what you do, Dr. Anderson. So when I was researching it and all, I saw testimonials too. I did. Sure. And then just knowing what you did and then meeting with you, I just knew. I just knew.
Very good. We appreciate it. Well, I always thank you for coming here, having faith in what we could do for you. And it sounds like we've delivered. I'm really happy to report that to everybody.
Yes, you did.
You've been really great to work with. You've got a very positive spirit, I guess, is the best way to explain it.
And just keep going. I'm telling people, just the 3-4 months. If it doesn't happen right away after surgery, just keep going forward and keeping that
try not,
positivity.
My message is don't wait too long. That's my message. Again, if you've had a procedure on hip or knee and the results drop foot, because it can happen.
Yeah.
And it happens with, good surgeons. It can happen. Then don't wait, because a lot of them don't know the difference. They really don't. And they aren't as trained as we are in peripheral nerve world. And they may not even know that there's an opportunity that exists to intervene earlier to maximize the improvement that you're going to get. And don't be waiting a whole year. So.
And that's why I commend you about that too. I'm glad I did it right away, like you said. That's one thing.
Right.
They need to do it right away, like I did too. Yeah.
Exactly. Definitely.
Yes.
So we catch
Yes.
people that come in. We just had somebody the other week, a young lady, sprained her ankle really bad. It's a long story, but she had drop foot immediately. And, we did some non-surgical things to help her and save her from having surgery. But she got here early, and it was amazing to see how fast she recovered. But that's not common. But I really appreciate you. I love talking to folks like you. And we'll probably keep in touch. And
yes, absolutely.
Hopefully, I want to see you playing pickleball or something down there in Florida, I guess.
Absolutely. Okay. I will. I'll take that up.
You're a pickleball. You're not a pickleball player, I guess, huh?
More of a runner. I hope I get back to that.
Yeah. Okay. Well, get back to running.
Yes. Thank you so much, Dr. Anderson.
Okay. Thank you. We appreciate talking to you. And thank you, Mike.
Yes.
For bringing her out. Okay. Thanks. You take care.
Okay, bye-bye.